Hello, this is David Kettlewell, and welcome to Medical Matters because life matters from Buffalo today. This is going to be a show I think you'll really enjoy a lot if you have children or you know somebody that does. We're going to be talking about parenting, we're going to be talking about nutrition for young people, and we're also going to be talking on tips to overcome problems at school. It's a great show. Thanks for joining us. We're going to be talking about parenting again today, and I want to introduce our guest. And we have with us Dr. Arthur Lavin. You are a Harvard graduate, you're a pediatrician, and you're with Advanced Pediatrics. Thank you for coming, Doctor.
Thanks for having us, David.
And we also have with us Susan Glaser, co-author of some books with Dr. Lavin.
Yes.
And Marti DeSantis. Thank you for joining us.
Thanks for having us.
Doctor, if you could, just introduce the two books to us, and then we'll get into our information.
Sure. Susan and I collaborated over the last 12 years writing these two books. One is an overview of parenting, presenting a great philosophy of parenting and specific approaches to solving the most challenging problems of raising young children. And the other is a dummies book on baby and toddler sleep solutions.
Now, folks, just so you know, those dummies books are not for dummies. They're actually some of the best written books and best edited in the market, and there's really hundreds of them in print. First question, do people need help with parenting?
Well, I think most parents would say it's a daunting challenge. And everyone's good at loving their children, but when children come back and challenge them with tough problems, I think parents are grateful for any tips they can get.
The best people to ask questions about parenting are parents. Let's take a look at these questions.
Is it safe for my child to take vitamin supplements? And how about herbal supplements?
My son is a very picky eater. How can I get him to try different foods?
I'm wondering, when Will gets old enough to eat solid foods, should we stick with organic foods? Are pesticides dangerous?
Question 1. Are foods grown with pesticides safe for kids, and should you buy organic foods?
You know, that's a great question, David, because I think everyone's scared about whether they're feeding their children foods that are safe or not. But there's so many things that are applied to foods to make them healthy and good for us that I think it's important for parents to know not just what's dangerous, but what's safe. And Ms. DeSantis and I have been working together trying to advise families for some time on good approaches to nutrition. I'd like to hear what you think about pesticides, too.
Right. Well, organic is very popular right now, and people are really into buying organic for their families and for the kids. One of the problems, yes?
What does organic mean?
Organic, you know, there's really no set guidelines for what organic means. But basically, it is grown without pesticides and usually in very nutrient-rich soil. What people do, people are scared of the pesticides that are grown in, it's called traditional farming. What is happening is the government does have over 100 different tests for foods that are grown with pesticides to make sure that they are safe for kids. And a lot of the tests are directly applied to kids and their height and their weight and their growth patterns.
That's a controversial topic, though, because the charge on the other side is that the testing is controlled financially by the manufacturers of the pesticides, which in most cases is true.
Right.
So I guess the question is, what percentage surety or comfort should we as Americans have with eating foods that have pesticides? As an example, I've heard all fruits and vegetables are sprayed, but they recommend you wash them before you eat them. I mean, is it a matter that there's a preparation that makes a difference, or is the whole pesticide thing no good or good?
Well, washing definitely will get rid of any residue that might still be on the fruits or vegetables, so it's always a great idea to wash.
Do you have to use soap?
No.
I was going to say,
Water's fine. Water should be fine. Actually, there are products, something called, I think iFit or something that washes, you could buy in that's really unnecessary. Water will be fine.
So it's okay then to buy foods that have been grown with pesticides, in your opinion?
In my opinion.
Doctor?
I'd agree.
Okay.
As long as you wash them.
Should you buy only organic foods?
Organic is always a good choice if, first of all, if you can afford it. A lot of families can. Organic, and especially with the price of groceries now is going up so much. If it's something you can't afford and something that doesn't fit into your budget, then normal, traditionally grown foods are fine to feed your children.
Approximately a 50% premium to purchase foods that are organically grown. And I have read some research that indicates that the mineral content of the food is higher by a factor of as much as 10 or 100 on organic versus non-organic foods. Any truth to that?
Well, you know, either way, minerals are good for you, so having extra minerals presents no harm.
Okay. Let's take a look at this. Parents are so concerned about their children's eating habits. I mean, this is a focus for almost every family. And it would be true for adults too, by the way. We adult children, because we're all children, I guess. Yeah.
We're still eating.
Well, how can you make sure that your child is getting all the nutrients that they need for their health?
Well, that's a topic you have to deal with. Pesticides are controversial, but eating is something you have to do. And I think the best thing to say is fruits and vegetables are the best foods in the world. Whole grains come in a very close second. So the more you can eat of those, the better off you are in any case.
What's good about fruits and vegetables?
Well, the nice thing about fruits and vegetables is that they contain foods that we evolved to eat. Humans evolved as a species along with these plants.
I thought that we were evolved to eat McDonald's burgers.
That's more recent human history.
Believe that.
Which brings up my next question.
Barbara, right.
Are fast foods food as defined by a nutrition, you know, with vitamin, mineral, content, fiber? Or are they something that look like food and taste like food but really don't deserve to be called food?
You know, I think we have to say that fast food have calories, have minerals, have food in them, but I'm not sure they're the best food.
No, they are a source of energy. They're a source of calories. And I think that fast food can be fit in. A lot of times people need to go through the drive-thru. People are busy now, and people need to use that as a source of food sometimes. But I think that it really needs to be included as an part of an overall healthy diet. You know, maybe once a week, if you go through fast food, that's not going to kill you.
If we take a look at rates of heart disease worldwide, the United States is fairly high, atherosclerosis and these types of things. As the Asian markets have started to duplicate the American diet, their rates of heart disease, which had been very, very low, have started to rise. What's wrong with the American diet?
Well, I think the main problem is the extreme excess of everything. So we eat a lot more of nutrient than we need, and one of the more dangerous nutrients are animal fats, trans fats, and excess calories, all of which you don't see in undeveloped countries.
Is it healthy to be a vegetarian?
Yes, I think it's a good way to go if that's what you choose to do.
What's
you can
wrong
have
with
a very
eating?
healthful diet being a vegetarian.
What would be wrong with taking the approach, I'm going to eat what I like?
You know, actually, nothing's wrong with that either. I think that as long as you do it in moderation, like we're talking about the fast food, if you go through McDonald's or fast food every time and get a supersized meal, now that's not such a great idea. If you go through and you get a cheeseburger and a small fry and, you know, a diet soda once in a while, that's moderation. And I think that's how it should be with everything. If you like to eat ice cream and then you know, have a bowl of ice cream when you feel like having a bowl of ice cream, but you should also feel like maybe having an apple once in a while or having some healthier foods once in a while as well.
Putting munching into perspective, let's say that there's 100 base units of food. In a quality diet, what percentage should be junk food, fast food?
Oh boy, that's a good one.
I think a tiny percentage. I agree with Marty. You know, I think.
Well, what's tiny?
I think a treat is just that. It should be occasional. So I'm thinking less than 5%.
That's
Less
what
than
I was going to
5%.
say.
Yeah.
But that doesn't reflect Americans' consumer habits right
No,
now.
Not
it
at
doesn't.
all. In fact, if you look at children's caloric intake, how much they eat from age 0 to 18, you pile up all the food that they eat in the course of their childhood, 10% of all the calories that our kids eat in this country are from soda and juice, and 40% are from junk food. That's way beyond the occasional treat that we've been talking about.
Next question from one of the patients, and those actually were comments from patients.
Right.
My son's a picky eater. How do you get somebody to eat a wider variety of foods?
Actually, I just want to comment on that because one of the things that happens when a child enters toddlerhood is that parents are surprised that this voracious infant is suddenly like they're going on looks like they're going on a hunger strike, when actually the caloric intake necessary for toddlers decreases dramatically. So what happens, I think, is that's like a really crucial point for parents.
For more Medical Matters television shows, go online to medicalmatters.tv.